the first 10 minutes after they told me, I was in shock. And then I remember just thinking, right, so how are we going to get over this? And yeah, I kind of just always thought about, when I'm over it, what am I going to do?
This is the first time I've been in hospital with a really serious illness, and it just came to shock to me and my husband. And I didn't have time to think or what to do.
No control over it.
Yeah, and even the same with my husband. We were like, as soon as she told us, both of us just burst into tears, because it was something that we didn't expect. Before she said, you've actually got some sort of cancer, blood cancer, but we don't know which one. So that shocked me a lot. And then the next day she said, obviously they did more tests through the night to find out exactly what I had. And then when she came and told us, my husband was there, my sisters were in the room, and she said, do you want me to tell you on your own, or shall I tell you now? I said, well, tell me now, because I'm going to tell my family anyway. So when she said that, we were all in shock. And like I said, all of us were just in my room. We were all just crying, because it was something that none of us expected.
Oh, you don't, do you? No. That's the last kind of diagnosis you're expecting.
Yeah. I was like in a daze. I didn't have no idea, how all I could think about was my husband, my kids, and my family, and like my sisters and my mum and dad, and I just didn't know what to expect. I was like really traumatized. Yeah. And my husband was my biggest support, and he said to me, don't worry, he goes, we'll get through it. We've got our kids, so don't even worry about that side of things. The only thing that we need to worry about is getting you better and back at home, which is where I belong, so, yeah.
I do remember earlier, before the donor was found, sort of asking the consultant, well, how long have I got? Which is a little overly dramatic.
But natural.
Yes, yeah. And you do sort of review your personal situation at the time, don't you? And then you sort of cope as best you can as the journey progresses.
I had to know what I was letting myself in for, so I did ask a lot of questions, and I wanted to know.
Pre-warned, prepared almost for it.
Yeah.
But then I kind of went too far and almost scared myself. So I had to. I then laid off the Google. Everyone reacts differently to different things. So statistics mean nothing.
I tried to not know that much information. No, I didn't want to know anything, so all that was in my mind was, this is going to work, and when it works, this is what's going to happen, and I didn't want to know the complications, because I kind of thought that if I didn't know them, then they weren't going to happen.
Yes, I couldn't take that
helped
approach.
Me it helped me keep my positivity.
And then I got called from hospital to say that I need to come in to do all these tests, and then that's when it really hit me that I'm going to be in hospital for 3, 4, whatever weeks. So I was really scared about that.
I remember me and my mum were laughing because it was like an egg hunt around the hospital, because you had to find all the different compartments. And I remember I was quite excited at that point, because I was looking at it like, this is the final hurdle. So once I've had the transplant, it's just a road to recovery. There's no more treatments or nothing to make you feel unwell. At the same time I thought, right, it's all for a good cause, it's all for a good cause.
So the feeling the week before going in to have my transplant, I think it was very much a countdown feeling of, in my diary, trying to fill in as many things that I could physically do, because I had to be realistic, but things I wanted to do, things that would benefit myself, but my children, my partner, my friends. I wanted to it was a slight party feeling as well, of excitement, of the countdown, and trying to be positive, and filling my time as much as I could.
It was kind of that anticipation, going into the unknown, not too sure what it was all about, being through the kind of chemo. It was a new experience in itself.
Knowing that it was a whole different, that we
yeah.
were going to something that was a
Completely
whole different level,
being
but
told.
we didn't know what to expect.
Yeah, absolutely. And
It was going to be bad, but it wasn't good, but not knowing.
Yeah, absolutely. So that anticipation, trying to keeping upbeat around it as well was pretty important for me around that. And it was all that support, all that network and everything.
Maintain a level of stability.
Yeah,
Yes,
yeah.
for children, especially if you have children.
Absolutely, it must be.
I have 3 young children
Major
who
challenge.
it had to be just this was happening.
Mummy's going up.
And Mummy's
we'll
going
be
into
away for a
hospital.
little while.
We'll be away, but this is how it's going to work. And just trying to set up as much stability for my children.
Yeah.
For me, it was like a sense of relief that, let's just
The day
get
was
it
here.
done.
Yes,
You know, I've been waiting for that because obviously you told me it will happen and it's unavoidable. Let's just get it done because I want to tick this box, finish that and continue with the rest of their life. You know?
Yes.
Yeah.
I was excited about having my transplant because to me it offered a hopefully potential cure. Getting to grips with your diagnosis, to going through the treatment, to then starting to feel better, going out again, seeing people, eating well, and then to sort of come back into the hospital environment.
And each time you come in, you kind of, the more times you're admitted or have to come in, you dread it more, don't you? Because you're just like, oh, when's this going to be over with?
Yeah, it hits me when I leave and I spend half the car journey in tears. But then it flips round and, you know, the nurses and everyone's so lovely and you very quickly fall back into that routine again.
I mean, I did one thing, which was I'd always felt if I'm going to be in a long time, I asked if I could bring a duvet in. And that made a big difference to my life. That 6 weeks was having my own personal duvet rather than the strange little...
I always had my own pillow, always brought my own pillow and a kind of a blanket thing.
Knowing exactly what I needed and what was going to make my environment good for me.
A bit more homely.
And the cushions, scented things that made it less sterile and less hospital-like, for me, really, really helped.
Yeah.
It's an exciting moment, isn't it? That when it's dripping the stem cells to your system and you think, this is what I was waiting for the nearly 6-9 months. Yeah.
It was like ticking those boxes, wasn't it? On that, and to getting well. It felt like a good moment, didn't it? Like we're going forward.
We've reached this stage. We've reached this stage.
Even if you don't feel greatest at that moment, but you understand why is that happening. You just know weeks, months later, it will get better.
Yes. And because my sister came here to have her cells harvested, there was something so exciting about... It was the one day I didn't have any procedures myself going on. I didn't have to have anything happening to me. It's my one day off in the whole process. And coming down to one of the rooms here where she was having everything harvested, and her in bed and me at the side of the bed and she was the patient, to be on that other side was so positive. I felt so positive. And I was jumping around like
so that must be completely different to what I went through because my cells, they came in a little box, from someone.
Whereas I saw mine, they were
somewhere
coming
else
out,
in Europe.
And it was being steadily
growing.
The package was, and they got a wonderful amount. My sister produced fantastic cells, and it was a feeling of almost that I could see this process from the word go. Those build-up days beforehand was very much, and then afterwards it does. Things do start to kick in.
Yeah.
But you know that it's...
For the good reason.
Yeah.
Yeah.
You know there will be an end to the bad.
It is. It's because, you know, let's be honest, the journey is not the most joyful journey, but you have to go through it and you have to always have this picture in your mind that, yes, this is this, you know, beautiful life on the end of it, which you want to go back to. Yes.
And there's always anti-sickness drugs.
Yeah.
In the meantime.
there are people and there are drugs which can help you. Exactly.
Yes. There's
They're not going to take everything away, but they can reduce...
There's something that can make it better.
It's easy to forget that you know what the donor has to go through quite a lot to give you what you're, you know.
Sometimes I think as well, I don't think the donor knows how much they are saving your life.
Yes. Yes.
I didn't like the hospital food, so I wrote my mum a menu. So we just, she just brought obviously you can't eat a lot, but, and then I got ill, so I couldn't really, felt unwell, so I couldn't eat in the end. But no, I wrote her one so that every day, because the thought of I feel like when you don't want to eat, the thought of having to eat is worse. So
yes.
I wrote one before so that I didn't have to think about it. She just knew, right, I'm going to bring her this, and then it's there, and you have to just kind of get it in you. Did you lose your taste as well?
Initially
really?
I did, but it wasn't too. I was lucky in that sense. I think I didn't really suffer from mucosis, and taste, yes, went a bit weird for a time from the chemotherapy.
Yeah.
But I didn't suffer too badly from that.
Needing the tubes, I was very worried about that. Needing the NG tube afterwards, that was a big thing for me.
I was quite lucky I didn't have to have one. They tried about 3 times to put one through. They didn't manage, and I was quite lucky I didn't have to have one because it wasn't...
That was one of my big panics, actually.
Yeah.
What is an NG tube?
For feeding.
It's for the feeding through the nose.
Okay.
So I was told I'd need one, and so I had it, and it was probably one of the worst times.
Experiences.
But it was literally a 10-minute worst experiences. That for me, especially in those early days where it was a cup full of drugs you were taking 5 times a day. It felt constant, and I didn't want it out in the end because of the drugs. It just made so much difference that everything went down. It ended up being a, can I say, a positive experience? I don't know if I can twist it quite so much, but it wasn't
like
as
a holiday
bad as I
package you want to
thought.
recommend, but yeah, there are positives in that.
For me, anyway, it was a lot of ice creams and ice lollies while I was in the hospital, because once I did get the mucositis, and but I didn't want to be fed through the tube, so I was just trying to eat lots of ice cream and stuff you don't have to chew and stuff like that. But even then, when the dietitian, when she said, yeah, we're going to have to put the tube in, I said, oh, how long do people normally have it? And she said, 10 to 14 days. And I said, all right, okay, shorter than I thought. And she was like, wow, that's the first person that's ever said that. And I was like, oh, well, you know. And then the same approach with that as well. I just thought, you know, I've had it in for 1 day now, so it means there's 11 days left. And I just tried to count down from 12 down to 0, and it kind of went quickly. Like, the days do go fast, I feel like, when you're in the hospital.
I found that after the transplant, my skin colour went really dark, and I told when the doctor came to see me, I said, oh, because what's happened to my skin? And they said that apparently it happens to darker toned people. Skin goes darker, but they don't know why. But it was really frustrating. No, it's come back to my normal colour now, but for the time that it was like that, I felt really weird.
Well, I certainly felt that went to the shower and looked if I'd got a suntan. I'd just been on a sort of Mediterranean holiday or something, and that lasted a bit.
The other thing,
talking of skin, was my hand. Did you have my hands and feet, the skin peeling? And that was really a bit, because nobody had warned me about that. And
I think you're warned. They say you'll get a sore mouth. I think sore mouth is. I mean, that's making it sound like easy, but I mean, it was excruciating. It was incredibly painful, a lot worse than I got it with the chemotherapy as well. And I would have described that as a sore mouth, but what came with the transplant chemotherapy was, agony. All the way down. I couldn't swallow. I couldn't breathe properly.
It's almost like severe tonsillitis. It feels like, doesn't it?
Yeah.
Yeah. I think that's like a better way, isn't it, than a sore mouth?
I think I was lucky. I just had a few ulcers and a bit of soreness. And
it's funny, isn't it? Everyone's different.
And a sore bottom, but but overall, you feel that your digestive system is not as it should be.
No.
Just get really tired all the time. And Gill did say when I left the hospital, she goes, don't underestimate the power of chronic fatigue. And I was like, yeah, okay. And then but when I got home and I kept getting it over and over, and I was like, Gill was right. And when I came to see the consultant, I said, I keep getting this, and Gill goes, see, I told you.
Yes, she did,
So.
What about nausea? Because I must say, until, in fact, this week, I felt sort of nauseous, not enough to make you want to be sick, but that sort of always that feeling that underlying. Did you have that?
Yeah, I found that, and I found after taking my tablets, before taking I'm on cyclosporin.
Yeah.
Once I took the cyclosporin, I kept throwing up afterwards.
Yeah.
So I'd have to take anti-sickness about half an hour to an hour before taking the tablet, because I especially got it then.
I didn't suffer from it. I think my sickness was quite well managed. I didn't really feel that nauseous at all.
For me as a female, I had blonde hair down to here, and my hair was always I always wore full makeup, always had my hair done, and that was something that played heavily on my mind about my hair going. And I remember when I first said, but will I lose my hair? And when they actually said, yeah, I'm thinking, oh my God, I don't know how I'm going to deal with that. I don't know if I'm going to be able to cope with it. Will it be too much? And looking at myself in the mirror and thinking, I won't be able to even look at myself. I'm going to find myself so unattractive. And I remember the first time that it started to tingle, and saying to Gill, it's just this weird sensation in my scalp. She said, that's because your hair's about to fall out.
At least you got a tingle. I would just take my head off the pillow, and I'd see hairs on the pillow.
And then see every morning waking up and how much has gone today.
And the sheets were covered.
Yeah.
You accept this temporary image of your body being a little bit different at that moment.
Yes.
And we're not very happy when we lose hair or something has happened to our body that didn't happen before. But I always thought it's only a temporary situation. It will get better. Sooner or later, those tubes are going to come out. The hair going to start growing.
And seeing those first few hairs coming through.
Exactly.
I'm sure there's a bit there.
Exactly. You
I'm
should.
sure there's a bit. There must be a time when finally...
there's days in the mirror.
Yeah,
well,
absolutely.
I always had chest hair and body hair, and I think I had too much. But when I lost it, I really missed it. It's got a little easier, but the chemo has still really affected me in that side of things.
What did bother me a little, especially when the sort of skin discoloration that I've got now started, and it has been a lot worse, getting a lot better. There's no discomfort, it's purely sort of self-image. But when I went to collect my granddaughters from school, I was seriously worried about sort of scaring the other kids. Or it's strange. You've always got to sort of tell yourself how you perceive yourself. It can be so different to how others perceive you.
There are certain things you cannot change, and what option do you have? Feel sorry for yourself, or accept it, and get on with it.
Yes.
You know, and there are only two approaches to it. That is my opinion.
You have no control.
I wasn't happy that, I grew a bit as a side effect of leukemia because I didn't have to shave the wall. It was a bit of laziness, but I liked it. And when I lost it before the transplant, I was a bit gutted, it's not going to grow back. The same
It's a bit
shape,
embarrassing as well,
bigger,
because it's
smaller.
wispy, isn't it?
Yeah.
When it first starts to return.
Yeah. It's just accepting this period of time, and then, we'll say 99% of patients will go back to the right condition, because we can't generalize that everyone will be perfectly cured, but for most of us, we're going to go back to normal life. So most of those effects will fade away. Yeah,
I've lost weight during the process, but then I don't know what would have happened to me anyway. I might have lost weight. I don't really know how to gauge what impact the medication, the illness, and the sort of general sort of progression of life.
It's interesting because men are not really supposed to talk about self-image.
Why?
Well, it's things have changed. I agreed, but I still think it's not like a masculine thing to do. I think secretly, of course, the grooming thing and the cosmetic thing is now marketed where it wasn't marketed when I was a young guy, but it's still something I don't think a lot of men...
I'm sure it's very different to my experience.
But that's, I think, a sign of the insecurity. And the way to hide it is to hide behind the clothes or the cap.
Yes. Well, hats, scarves, we all... Yeah.
I think, too, it depends on pre-treatment. How do you feel about yourself before you get ill? And I didn't feel good about myself anyway then, and it's probably worse now. It's not that I don't manage it, but it's really difficult. And I just get so tired. So even the thought of meeting someone and then not being able to keep up is a worry as well.
There's a lot of pressure in those early days, that you're having a wonderful time. You're going out, you're doing wonderful things, and you're creating a new relationship and so on. And then to suddenly, overnight, be on death's door, really. There was a lot of pressure.
There's probably no rule how long you've been in a relation, does it going to kind of cement or not, but obviously if you've been for longer, you feel a little bit more secure.
Yes.
You went through at least something together in your life, so that
and also this feeling of we shouldn't be going through this.
It's
we're
too early
having
for that,
fun.
yes.
We should be discovering each other. But in the same way, because we hadn't been to, it was the most wonderful environment to actually get to know each other.
But I think it can be a really tough journey, if not tougher for them.
I believe it's
definitely.
tougher. I believe it's tougher.
I think it's tougher
because they feel helpless.
From watching my wife when she was coming after work, which obviously was quite challenging after a long day at work, coming quite late in the evening when the ward is officially closed. Yeah. Sometimes she was even falling asleep in a chair. I was saying, listen, go home because you're tired. You're not going to help me anymore, you know, I'm feeling okay. And I've seen the stress she was going through and potentially it's the pain, the inner pain, which...
And a lot of tears out in the corridor.
Yeah, when they walk out, exactly, because they want us to see it. Yeah,
they've got to be, there's the pressure. Yeah. We're allowed to feel how we do. We're allowed to feel upset. We're allowed to feel sorry for ourselves.
We can be grumpy because of the chemo and everything else.
But
for them, it's completely different.
And they've got to second guess what mood we're in. And
plus, they've got all the households to look after as well when we're potentially in a comfortable environment.
Oh, we've escaped.
I actually enjoyed being in the room most of the time and the space that I had and the peace. And I didn't have visitors. I have some cousins in London that did come once, but I didn't feel left out or want anyone. I was quite contented. But when I met other people, and I always thought about the partners because I thought they're going through a different experience.
It's interesting, actually, the different times, like you saying you were in over Christmas. I was in the summer, and it was very bright. I used to find that it was very light. You know, the light evenings and the light mornings made a difference to your mood.
Yeah.
Indeed. But I had a room where I could see the sky.
Yeah, nice. Yeah.
And it did make a difference.
Funny little things like that do make a difference, don't they? And you just...
I quite liked being in an isolated room as well.
Yeah, that's good.
Yeah, because you didn't have to. You could just be comfortable. You didn't have to think of other people or anything like that. You could just be how you wanted to be.
It's a strange mixture, isn't it? Because it gives you that privacy, and you have to become. You just get used to being sort of self-contained and making your own days. And
I think routine is a big thing when you're in hospital because you know when they come in at 7 or 8 o'clock asking what you want for breakfast. I was kind of fast asleep like. Breakfast?
Yeah.
And then, I'd just kind of eat my breakfast and then I'd always try and shower straight away. Yeah. And then I'd always try and move to the chair.
Yes, yeah.
Because I just didn't want to stay in bed all day. Obviously, there's days when it can't happen, but...
Did you put your own clothes on as well? I found that quite...
I found that it was when I could, I certainly got dressed and...
Yeah, because I had my nightwear and then I had my just like loungewear, like I just put on some tracks and then, because even then at the end of the day you can put your pyjamas on
Yes.
It's like an event, it's like, right, I'm getting ready for bed now.
Yeah,
so
exactly.
I'm going to clean my teeth or whatever you do. And again, it's part of that routine. Yeah. And I found that helped me at different times of the day.
In the beginning I didn't it scared me being in the hospital overnight on my own. Yeah. So I liked that you could have like someone there if you needed them there.
There is this moment when you feel you don't want to talk to anyone, you don't want to see one. You want this moment of quietness and a bit of loneliness, maybe even to reflect. You don't know what goes through your head. Yeah. But I felt that at some stage that I stopped replying to people, to text messages, to Facebook messages. And I said, well, don't come see me today.
I was told, like, this is how you're going to feel, like, getting up to go to the toilet is going to be a chore. And so I almost thought, no, I'm sure it'll be fine. But then it was a shock then when I did feel unwell. Once I started the high-dose chemotherapy, I did feel quite unwell and I was like physically vomiting and stuff like that. But at the same time, I just thought, all right, I've made myself sick from being hungover or something. So I just thought, this is, right, it's going to be over in a couple of weeks and then I'm on the mend and stuff like that. So every day, so first day of feeling unwell, I thought, right, okay, that's 1 day down and 7 to go, or you obviously don't know how long you're going to be unwell, but I just thought this isn't going to be forever. So for every day that I did feel sick or whatever, I just thought it's 1 day closer to feeling better.
Take it a day at a time, because how you feel today, you're not going to feel the same tomorrow.
Exactly.
You've got to think of all the positives, because that's what's going to keep you going.
The other thing I used to try and do was go for escape and go for a little walk out into the park. And they used to sort of look at me a bit suspiciously, and I'd say, well, I'll keep my mask on, and but I did, just to get it out and a bit of fresh air and escape from the room even for 10 minutes was quite important.
For most people, I'd imagine there's never been a time in your life where you're not walking up and down, just not walking around.
No, of course.
I lost all the muscle in my calves, and I just thought it was just shocking how that happens. Like, so every time my tablets came around, because obviously that's the certain times in the day, I'd get up, and after I'd taken my tablets, I'd like walk on the spot or do like a few laps of the room or something like that to try and rebuild the muscle.
The exercise bike, did you have a go on that?
Yeah, I did after once I got a bit more strength, but even that, 20 seconds and I was like out of breath.
Yeah. It's amazing how quickly the muscle sort of deteriorates, but how slow it is to put it back on again. That's what I found. I found it, before you know it, it's like, gosh, this is hard, but it's then quite hard to build up again. Yeah. Did anyone have foot massage woman come round?
Yeah.
No, I didn't have that.
Oh, that was great. I used to like that. I used to look forward to that.
Yeah. I think light exercise is really important though, when after the transplant especially, because you're tired, but you have to, if you don't do light exercise, then you're not going to kind of rebuild your strength or, you know, it's just like getting fit again, isn't it?
Yes.
You have to I think you have to force yourself to do it, and that's one of the hardest things.
Knowing that you only had a few days left before you had to go home, and for me personally, I was scared because I did trust here. I was safe, and it was, for me, it's safety. That if anything happens, I'm here, and I ring that bell. And even though I'm quite close to the hospital, I was scared about leaving.
It was very mixed, wasn't it? The desire to be out and sort of rejoin normality, if you like, but also knowing full well that you're in hospital, any care or any treatment you required was so close to hand, and almost conflict between those two.
Well, you knew you were still vulnerable.
Yes,
so vulnerable.
How am I going to cope with my vulnerability? I want to be out there. I don't know how I'm going to cope with vulnerability.
It's very much a mixed bag of mixed feelings, because I wanted to get out since I rejoined hospital summer 2015. I wanted to go back home every occasion, but post-transplant, just a few weeks later, when you actually got a set date that this day we're gonna discharge you, you think, am I ready?
Yes.
Is it the right time to go? Or should I take another week or two? Can I stay with you?
Because there was something,
mixed feelings.
for me, there was something actually quite nice being in
It's a safe place.
I felt I was almost had my little holiday. I was there in my room.
Your apartment.
Yes, it was.
But I personally found it very difficult to judge how hard I had to try to recover. You know, what was expected of me, what could I expect to be able to do. I found that a bit of a puzzle, I suppose.
Yes, I didn't believe them when they said you're going to have chronic fatigue that you won't be able to do. No, I'll be fine. They don't get me. I'm strong. I've whizzed through that. I'm fine. I'll be different. I'll be different because chemo didn't touch the sides. I was fine. I'll be like that. They don't know. They keep saying this just to scaremonger.
Is this facing the reality post-transplant?
And then lying in bed and seeing a cup over on the far end of the windowsill that took me an hour probably to actually
get up and do
get
something
up.
about it.
I just can't go. Can't do it. Haven't got the. I think this is what they were talking about. They were right. And it doesn't necessarily happen all the time. It does come in
like a
waves.
Yes, exactly.
That sometimes you can do things,
You've
and
got
when
a better
you feel
base,
it, you can do
and
those
you feel
things.
you're on a nice hill to recovery, and then it can hit you back again.
Yes.
So you just have to go through it. You have to accept it and and take day by day as a challenge.
Exactly. Recovery is a rather uneven process, isn't it?
I was told you're going to be very tired. Yeah. And I remember going to sleep at like 9 or 10 at night and not waking up until 1 p.m. the next day. Wow. And I remember I called Gill and I said, is this normal? And she was like, yeah, it's normal. I told you you're going to be tired. And you almost try and wake yourself up, but you're as tired as if you've woken up at 6 in the morning or 5 in the morning. But you have to just... And then as well, I found it hard because you have to fit in drinking as much as you need to drink and eating as well, but you're only up for 9 hours a day or something. So I found that hard, having to wake up to eat as well when you're waking up at 1 p.m. or for me anyway, that's how long
and
I was
taking
sleeping.
The medication as well.
Oh yeah, exactly.
Times you've got to sort of factor that in as well.
You actually just have to kind of listen to your body and just...
It's different to needing an early... to, you know, when you're tired, you go, oh, I just need an early night and then I'll be okay. It's not like that. It's like your whole body kind of feels heavy and, you know, like you're kind of dragging it along almost.
And did you feel breathless? I mean, I found, you know, walking up, so 2 flights of stairs, and you'd be at the top going, you know, quite out of breath and almost slightly dizzy, and having to sit down for a few minutes just to recover from that.
The support from not only the hospital environment and the Macmillan and the Maggie Centre at Charing Cross, that support's been superb.
It does, like you say, it doesn't last forever. It does get better. Things grow back, appetite comes back, weight goes back on. Yeah.
Gill, the nurse, was just my point of call. She was like my second mum. And things I'd normally ask my mum, it was like, actually, let me ask Gill. Because it was just she knew what was normal and what was signs you should look out for. And just
what to expect.
What to expect and what's to come. And I found she was the main person for me that.
I found that as well. After the doctors came to, because they come and see you every day. So after the doctors come and see me, they're like, say this. You're not really not with it. So I always found myself telling the nurse who was looking after me, can I speak to Gill? And then Gill used to come up and explain it without all the big words. So I found that I could understand it better.
Yeah, it's a lot to take in sometimes. Because about 5 or 6 people come in and kind of stand around your bed, and it can be a lot to take in.
Yeah, you're like, oh, don't know what that was about, but but I did find that Gill did help a lot.
Yeah.
And I still find myself contacting her if anything happens or if I need anything.
The duty registrar, whoever would come in, and they were often very helpful. And I think I had one particular doctor who, at a sort of critical time, was there, and she would be really informative about, you know, where you are, this is what's happening to you, we're going to give you a bit more of this and a little less of that, and very reassuring, you know, you're doing really well, and that was really helpful. And the nutritionist?
Oh, she was quite good because she arranged the special soups and things that when I was finding it very hard to eat, I think they were called meritine soups. She arranged for those to come up for my lunch instead, and they're very easy to eat. They're quite flavoursome, and those hideous shakes, the Ensure shakes as well. Yeah.
I found that
I quite like that.
The ward nurse is quite comforting as well, because you know the times when you were in your room on your own and you just kind of be a bit like, it kind of hits you, doesn't it? You know, and you've got people with you, you just talk about other things or stuff like that. But then there were times like when you were having the chemo, like the first day of chemo, it kind of hits you, doesn't it? And then I remember the nurse came in and I started crying, and she was like, "Oh, come here, are you okay?" And stuff like, and then the same thing as well, like the doctor ward rounds they'd come around and they'd tell me something, and I don't understand, and have to call the nurse in and say, well, this is what they said, what does it actually mean? And they kind of put it in layman terms for you, and they were lovely. I found the nurses as well.
Incredible.
Just like really understanding, and they kind of had the knowledge of the doctors but put it to you in a different way.
The thing I found was obviously because you're not working, so you're not getting any money or anything. So Gill sort of said to me, "Have you applied for all your benefits?" And I'm like, "Well, I don't know what to apply for."
That's true.
So I had no idea. And then she got the Macmillan lady who does claiming benefits and stuff like that. So I had a lady from Macmillan coming up to me to talk about it, and I found her very helpful.
Yeah.
And she even, when the forms came in, she even helped me to fill them out.
Yeah.
So, yeah. And I also found that, like, you know, because you sit in your bed the whole day, I asked if I can see a physiotherapist, because my hands were like, I couldn't move them really freely. And so the nurse arranged for me to see a physiotherapist as well. And they came to see me and gave me a few exercises and stuff to do, which was really helpful.
I was very lucky because I was offered the opportunity to go and see a therapist at Maggie's and talk through some things. So I wasn't at the hospital and I wasn't with friends and family. So I think that the kind of neutral atmosphere was very, very useful. So when we talked about things like death and writing a will, which is quite a sad thing, I think, and thinking, sometimes I live alone too. When I left home, knowing I was coming for treatment, you'd wonder if you would be coming back. And that's something, and I felt talking to somebody at Maggie's was really, really useful. I'm very grateful for somewhere like Maggie's. And it's good to have somebody neutral that isn't the hospital and isn't family, because sometimes the family can get upset about things.
You feel guilty about like that you're in that position, that the burden that it is on them, even though they don't feel like you're burdening them. They're not happy because you're the way you are.
And you say, "Oh, don't worry, don't." It's quite difficult, isn't it?
Yeah.
That bothers me most, I think. The impact, if I went, I mean, I'd be gone.
Yes.
End of story for me. But if you the downside of being in a sort of longer term stable relationship is the concern for the other, who you're leaving behind.
Yes.
And that used to upset me.
I think that was the biggest thing that got me through it, was how would... Obviously, I've only been with my boyfriend for 5-6 years, but I thought, selfishly, I don't want him to be with anyone else. Like, I'm 24, like, I don't want him to... Like, so we're still early. And then secondly, how would my mum cope, like, losing a child? Like, I'd feel guilty, even though I wouldn't be there to feel the guilt. I would feel guilty knowing that was coming. That's why
you were sustained by stubbornness.
Yeah, basically.
And how did he respond?
The same way. He was like, if I got upset, it was, "Why are you upset? Nothing's going to happen. Like, this is how you're going to be treated." And that's what I used to say to my mum as well. Like, I was quite harsh on my mum one day because she used to get upset to me. And I used to say, "But I'm not the right person because you're making me feel really, really guilty." And I said, "Well, why are you crying?" And she was like, "Because I'm worried." And I was like, "Well, you're worried because you think I'm going to die?" And she's like, "No, I don't." And I was like, "Well, then you wouldn't be crying if you didn't think I was going to die. So stop crying and get the positive energy out there."
We were saying earlier, and that we're the fortunate ones.
Sometimes the words that people use worry me because they talk about striving and being brave and all those sorts of things.
Even having a battle with
battles,
cancer.
yes, things like that.
I mean, it's not a battle. I mean, in a battle, maybe you've got some sort of something to defend yourself with, some sort of weaponry.
Yes.
Maybe there's hopefully a level of balance in that battle, but you're not hiding to nothing with cancer. Yes. So I don't see it as a battle at all. You're in the hands of fate. You're in the hands of, if you prefer the maker, and you just get on with it.
In terms of it, I think your mind is your weapon. I always try to tell myself it's not something to be scared of, it's something to be proud of. Like, because once you're over it, be proud that you've been through it rather than be scared of what's happening. Just try not to be scared and just be proud. Like, I'm not trying to make it sound like a blasé thing. Of course, it's not. It's scary, but you have to train your mind.
Arguably, your life has been enriched by the experience. You've got a better understanding of what life's all about when you emerge from the other side, and hopefully you've got a better appreciation of life and the value of life, and you can go on and enjoy it even more than you did before.
And without being gloomy, perhaps death is something we ought to think about long before we get to that stage.
Well, I think everyone does think about it, but it is a scary thought for people because it's like, it seems to, you know, it's going to be the end.
See, every time my appointments get further apart, I look at it like a milestone.
Do you want it that way?
Kind of, yeah. Because the less I come, I feel like the better I'm getting.